Today, let's talk about one of the important and common condition called varicose veins of the legs. What are varicose veins? It's basically dilated veins in the legs that happens because of the faulty valves in that vein. Normally, the venous blood has to travel towards the heart from the legs against the gravity. For that, there is a calf pumping mechanism and there are valves to prevent the backflow. When these valves are damaged for various reasons, that results in eventual formation of dilated veins, like a twisted veins in your legs called as varicose veins. Varicose veins is common in professionals who have long hours of standing, like teachers, police, bus conductors, security guards, and even in some doctors like surgeons. Goal of treating varicose veins is to close these abnormal veins with faulty valves. These dilated varicose vein cause symptoms like heaviness of the legs, night cramps, itching at the ankle, darkening of the skin at the ankle region, and eventually form ulcers. Interventional radiology offers a non surgical treatment to treat these varicose veins without having to cut open the vein. Through the means of a small catheter inserted into the vein, either by means of a laser ablation or a medically approved glue called VenaSeal, the faulty vein is closed and the blood starts flowing through the normal other channels, and the symptoms of varicose veins eventually improve. If your legs are feeling too tired at the end of the day or feeling heavy, do not ignore the symptoms. An ultrasound is usually recommended to rule out varicose veins. If you or someone you know are suffering from varicose veins, do ask your doctor for a non-surgical treatments like laser ablation or a VenaSeal treatment as one of the treatment option.